Hi there, I'm Dr. Christina O'Flaherty. I'm a clinical psychologist in private practice. And today I'm making a video and it's going to be catered towards some questions that I was asked to answer in one of these videos. And it's about trauma. And the specific questions are how to help someone who has anxiety feel comfortable talking about their trauma in therapy. And they wanted to know what is important about talking about trauma in therapy and how to work with the shame that often is a built-in part of the aftermath of a traumatic event. And I'm really glad to be able to answer these questions. These are very important ones for someone who might be considering going to therapy because of trauma that they have experienced. So the first thing to know is that your therapist will know that avoiding talking about the trauma itself is a built-in part of the aftermath of trauma. It's how we diagnose. It's part of how we diagnose PTSD, post-traumatic stress disorder. A component of that is that someone who's experienced a trauma is avoidant, anxious, or afraid of talking about the trauma. And so what you should know is that your therapist will be compassionate to that and will understand that that is part of what you're struggling with, is the avoidance piece. The other thing is that there are 3 stages of trauma therapy. The first stage, when you begin therapy for having experienced something traumatic, is a time to build up trust with your therapist, a time to learn some coping skills for difficult emotions, for managing symptoms that you might be experiencing because of the trauma. So the beginning piece of therapy, which could last months and probably will last months, is just trust building and shoring up someone who's experienced a trauma so that they have tools and skills for when you move into the next phase, which is to talk about the trauma in a very organized fashion, meaning that generally what you would do with your therapist is set an agenda for how to talk about the trauma itself. And you would start with the least difficult aspects of it. You would talk about things that don't feel as scary or difficult to talk about and move up to things that are the most distressing to talk about. And remember, because you spent time at the beginning of therapy working on specific skills and building a sense of trust with your therapist, you feel like you're doing it in a safe, supportive space that doesn't feel like it opens up this big wound again in a way that feels too overwhelming. So when you ask what's important about talking about trauma in therapy, it is really important not to overwhelm yourself again, re-traumatize yourself. And great care is taken by trauma therapists to be sure that it's done in a skillful way. Talking about the trauma is done in a skillful way that doesn't flood you with anxiety again, like the original experience did. Shame. You bring up shame, and that is such an important piece of the aftermath of trauma. It is such a common experience of trauma survivors to feel deeply ashamed of their experience in one way or another. And the really interesting thing about shame is that talking openly about your experience, about who you are, about the very things that you feel embarrassed or ashamed about, makes shame dissolve. And when you trust that you are being met with genuine and unconditional positive regard as you discuss things that are really shameful to you, shame goes away, it dissipates, and you feel stronger then to talk very openly about really distressing things. You know, the most important part, and this is the third sort of stage of trauma therapy, is taking this narrative, this experience, and making it just a piece of who you are. Trauma is the kind of thing where when it's not treated, it is the whole of who you are. It is everything. And it's very hard to connect to the world in a meaningful way when this big trauma is in front of you and keeps you disconnected. So the second and moving into the third phase of trauma therapy is creating a sense that this is one thing or a series of things that happen to you, but it is not the whole of you. It does not have to be you, right? And creating some sense of meaning around that, and that looks different for every single person, is something that's very healing. And so the third part of therapy is doing that, and also reconnecting with the world, not through the trauma lens, but through a more holistic sense of yourself. Not that you are just a trauma survivor, but that is a piece of who you are, and you are also a parent or someone who works, or a sister or a friend, and connecting with the world in that more holistic way is the third piece of trauma treatment, and that is really where a great deal of healing comes. So I hope that was useful, and if you have any other questions, or if other people are watching this and they have questions, I'm really happy to cater these talks to something that interests you or something that would be useful to you. So I do take requests, and I hope that you find the videos useful. Thanks. Bye-bye.